Today I'm going to do PP5 Vacs. So first of all, now I'm going to read the notes. So I got patient Mr. Peter Pitt, and he was prescribed 7.5 milligram oxycodone, which is a generic name for endone, for his chest pain. Okay, good. Hello, Mr. Pitt. I'm Jake, and today I'm your student nurse looking after you. And according to your doctor's plan, I'm now gonna give you some endone tablets for your chest pain. Is that okay with you?
Yes.
All right. But before that, I have to confirm your personal details. So could you tell me your full name?
My full name Peter.
And could you tell me your date of birth?
It's 1st January 1945.
All right. And can I check the armband?
Yeah.
So the MRN is 123754. 123754. Okay, no problem. And Mr. Pitt, are you allergic to anything?
I'm allergic to penicillin.
Penicillin. Okay, so what happened if you got some allergic reaction?
I would get a rash everywhere.
Rash?
Yeah.
Okay. All right, Mr. Pitt, at this moment, do you feel any pain on your body?
Yeah, I feel it on my chest.
Okay, so on your chest?
Yeah.
So when did it start from?
It's started today.
Today? This morning?
Yeah.
Okay. Is it radiating to other parts of your body?
No, it's only my chest.
Okay, so how do you rank this feeling of pain from 0 to 10? 0 is the least and 10 is the most.
It's 8.
8?
Yeah.
Alright, okay, Mr. Pitt, before I give you the medication, I need to check your vital signs, like your blood pressure and heart rate, because endone tablets will have some severe side effects on your body. So I just want to make sure that it's okay to give you the medication. Is that okay?
Yeah.
Okay, good. Okay, the vital signs results are good, so I can give you the medication. And now I'm gonna prepare the medication, and I'll be back in 5 minutes. If you have any question or need help, please press this buzzer and let me know. Okay? Thank you very much.
Yeah. Thank you.
So, could you please validate the order with me?
Yeah.
Okay. I got patient Mr. Peter Pitt. MRN, date of birth has been checked, no problem.
Yeah.
And he's allergic to penicillin.
Mm-hmm.
Okay. And the doctor prescribed 7.5 milligram oxycodone tablets for him because of his chest pain.
Yeah.
And that's a medication chart. So oxycodone, which is the generic name for endone.
Yeah.
For Mr. Peter Pitt, everything has been checked, and he's allergic to penicillin. And the date is today. It's by oral. The dose is 7.5 milligram twice daily. It's for his chest pain, and the signature readable enough, no problem. And it has not been given yet today.
Yeah.
So I can give it now.
Yeah.
All right. So now I'm gonna check the MIMS for the information of endone.
All right.
Okay, now check the MIMS for endone. Endone is one kind of narcotic analgesia, and it's for pain relief. And for Mr. Peter Pitt, it's used for his chest pain, and its contraindications including brain tumor, head injury, asthma, etc., etc. And its usual dose for adult, it's 1 tablet every 6 hours, and its route is by oral with water, and it should be taken after meals or with milk. Side effects including constipation, hypotension, nausea, vomiting, drowsiness, dizziness, etc., etc. And for nursing considerations, if the patient's vital signs are not good or not within the normal range, the nurse should not give the medications. And if the symptoms of overdose happened, naloxone should be given as antidote. Okay. could you please go to the dangerous drug cardboard with me?
Yeah.
Okay. So first of all, I will check the left tablets in the drug register and the bottle. Okay, so let's go to the page of Endom. Yep, it's patient Mr. Peter Pitt. So it says 2 tablets left on the drug register. So I'm gonna check the bottle. So that's 1, 2. So there were 2 tablets in the bottle. So the number of tablets in the bottle is the same with the number on the drug register. No problem. Okay?
Yeah.
So could you please do the first drug check with me?
Yeah.
Yeah. So I got patient Mr. Peter Pitt. Their birth MRN has been checked, no problem, and he's allergic to penicillin.
Yeah.
And the doctor prescribed oxycodone, which is a generic name of Endom. So that's Endom oxycodone.
Yeah.
For Mr. Peter Pitt. Date is today. It's by oral. The dose is 7.5 milligram twice daily. It's for his chest pain, signature readable enough, and it has not been given yet today, so I can give it now. Okay? And the expiry date for Endom is 2022, still in good use, so I can give it.
Yeah.
Okay?
Yeah.
Alright, now I'm gonna do the calculations. Okay, now I'm gonna do my calculation. So the dose is 7.5 milligram, and the stock strength is 5 milligram per tablet. Okay?
Yeah.
5 milligram. So I need to give him 1.5 tablets. Do you agree?
Yeah, agree.
Okay. So now could you please do the second drug check with me?
Yeah.
So I got patient Mr. Peter Pitt. Everything has been checked. He's allergic to penicillin, and the medication for him is oxycodone, which is Endom. For him, oxycodone, Endom oxycodone. And date is today. It's by oral. The dose is 7.5 milligram twice daily. It's for his chest pain, and signature readable enough has not been given yet today, so I can give it now. Expiry date 2022, still in good use.
Yeah.
All right. Okay, I'm going to take out the tablets. So I use this cutter to cut one of the tablet into half because I only need 1.5 tablets, and I chop the other half into the sharp container. Okay.
Yeah.
And now I'm gonna count the number left. So there's none left in the bottle. Do you agree?
Yeah. Yeah.
Okay. Okay. So could you please do the third drug check with me?
Yeah.
So I got patient Mr. Peter Pitt. Date of birth MRN, no problem. Allergic to penicillin. Medication for him is oxycodone, which is a generic name for Endom. And the date is today, and it's by oral. The dose is 7.5 milligram, and according to the stock strength, I will give him 1.5 tablets, and it's twice daily. It's for his chest pain. The signature readable enough, and it has not been given yet today, so I can give it now. And it's expiry date 2022. Okay.
Yeah. Yeah.
No problem.
Yeah.
go back to Mr. Pitt. Alright, hello Mr. Pitt. I finished preparing your medications and now I'm gonna give it to you. But before that, I have to confirm your personal details again. So could you tell me your full name
Peter Vida.
and your date of birth?
1st January 1945.
Okay, can I check the armband?
Yeah.
Mine is 1, 2, 3, 7, 4, 5, 4. No problem. And are you allergic to anything?
I'm allergic to the penicillin.
And what will happen if you have some allergic reaction?
The body get rash everywhere.
Rash, okay. And okay, no problem. And now I'm gonna give you your medications.
Yeah.
Okay. So that's your tablet
Yeah.
and that's your water.
Yeah.
All right. Thank you, Mr. Pitt. We're done, and hope you feel better soon. And you will have you might have some nausea, vomiting reaction, or dizziness. And if you have any of this problem, please let me know. Press the button and let me know, okay?
Yeah.
And I will be back after 15 minutes, and I'll be back to check your vital signs and do a pain assessment for you, just to make sure everything's going okay. All right?
Yeah.
Thank you. Okay, finished, and I'm gonna discard the equipment. Okay, so could you please sign this medication chart for me?
Yeah.
Thank you very much. And can we sign the drug register also?
Yeah.
Okay. So today is 27 March. Now it's 8 o'clock for Mr. Peter Pitt. And the amount given is 1.5, discard 0.5, though there are now tablets left, prescribed by Dr. Braun. Could you please sign here for me?
Yeah.